Hi everyone. So my topic for my research project was accessibility in public libraries, and I did a literature review. So the focus of the research was analyzing accessibility issues within the library profession from a broad focus and how it has been implemented within public libraries. And with the literature review, I was able to conduct an overview of how accessibility has been perceived historically by the profession and how it is discussed through the literature review. And from there, noticeable uh, gaps and themes emerge in the literature that prompted suggestions for improvement regarding accessibility. So, ALA's first committee for services to people with disabilities was established in 1906, but it wasn't until 1961 that they established the first policy for library services for people with disabilities. So even with ALA's um services 1906, 1961, uh the law in America was actually ALA was actually preceding official law before it was established in America. So prior to the ADA's, so the American with Disability Act passage in 1990, President Nixon had passed the Rehabilitation Act in 1973, which prohibited discrimination on basis of disability by federal programs, and which then the ADA further clarified the scope of protection and defined the civil and human rights of people with disabilities. And then we have in 1998 the Section 508 passed, which is what we know now as web accessibility. So the ALA was already performing different things for services for people with disabilities, but their library services for people with disability actually stem from efforts originally for providing print materials for blind users. Um, so then now we have, a lot more with that. One of the works that I read, they stated that ALA has no clear definition for what equal treatment and access looks like, despite access being one of the core values of librarianship. So that just kind of puts like the onus on people with disabilities to kind of spearhead efforts into innovation and creativity in trying to figure out what kind of services that they can establish and further enhance for people with disabilities. And that kind of goes into the discussion of the social model of disability versus the medical model of disability. And in general, most of the studies in the literature indicated that insufficient studies that include the opinions of people with disabilities concerning library services and access was very notable. So that's just a general kind of overview for ALA's history, historically, how they have dealt with or navigated services for people with disabilities. So within LIS like coursework, so JJ Pionk, who is a disability advocate and a librarian, he has published several studies within the literature, and it kind of from his articles or studies that I looked at, he noted that a lot of coursework was very general or broad in the focus of how they tackled disability within their courses. So there was varying degrees of prominence. Um, and the biggest takeaway was that most courses examined accessibility focus within digital context, such as websites, and it kind of reflected how discussion of disability itself is largely absent within the LIS coursework, and that they're failing to consider the histories and theories and the culture of of people with disabilities. And it also reflected how his other studies showed that library students don't perceive that they're ready to give service to people with disabilities. And his studies also showed that students said that their library programs didn't cover topics of accessibility and disability sufficiently. And when they did, it was mostly about being ADA compliant in terms of physical spaces. Again, we're missing that component of the people with disability and asking them how they perceive the space and services available to them. So then you see when research shifts to person-focused information, uh, when research shifts to person-focused, information isn't from users, but from information providers. So external people, not actual people with disabilities. And little research explored what people with disabilities might want from an information provider and how to best provide that information. And again, within LIS studies, there was a narrow focus about library services for learning disabled children. And the highest percentage of LIS literature regarding accessibility was about 25%, with the primary focus being visual disabilities. And I'll just touch real quick on the models of disability, which I mentioned earlier when I was discussing the historical overview of how accessibility has been perceived by the profession. So the medical model of disability is seen as the dominant perspective for legally mandated accommodations, and it sees that the disabled person's lack of ability to perform normal human activities can be traced to that person's impairment versus the social model of disability, which is developed by people with disabilities that says it is society that disables people with impairments. So again, it's just really important to take into account that a lot of the work that has been done from the medical model of disabilities point of view, rather than the social model of disability, which includes and centers the voices of people with disabilities. So there was a few real life examples. So we had the District of Columbia Public Library adaptive technology. So they followed a model for library services originally implemented by the visually impaired and blind user group, and they saw that the trend of the movement was a way to make audiovisual spaces accessible to people with disabilities, and that the disability community could gain from the maker movement by redefining it as a way to document how innovation originally comes out of the disability community, since necessity is the mother of invention. So in the District of Columbia Public Library, one example of innovation that they talk about was that the community they created the I3S Foundation, which was started by a group of blind individuals who hold a weekly support call and do assistive training in Android, in person and over the phone. And another example was the Blind Life Skills Training, where they offered informal peer-to-peer orientation and mobility sharing to the community. Uh, and while the author of this study or article talked at why accessibility to these spaces will never fully be there and will be slow to come, it was still important to recognize that every time someone with a disability hacks their way into an inaccessible system, that they are making something new and that these new things can be incorporated into larger systems. The next example, a real life example that I will discuss, is the Warren County Public Library satellite locations. So they began collaboration with LifeWorks, which is a community organization, which was that has 28-unit residential community that offers 2-year stays for neurodivergent young adults. And these satellite locations were designed to be a sensory sensitive environment to allow individuals with learning differences to concentrate, study, read books, and browse library sources. Uh, sta their staff member was familiar with neurodiverse populations, which allowed for bonds to flourish and for them to offer detailed training sessions for accessing library services. And the main point was that they were able to meet the neurodiverse population where they were at. So, in conclusion, from the literature review, is that I saw that there was a narrow focus on disability in literature, so they should broaden focus beyond specific disabilities, such as like visual disabilities, or not that they're not any less important, but they're very broad or general with their focus. And with that, it's important to include the opinions and perspectives of people with disabilities. They should be centered More inclusion of adults with disabilities should be taken into account since it was noted that about there was a very narrow focus about library services for learning disabled children. This also showed that LIS coursework should more aptly prepare students for working with persons with disabilities and should include disability theory, culture, and life in discussions. I didn't note it here, but I would also say that having universal design principles from the get-go, when implementing any type of programming or service within libraries should be essential. So if we have it from the base level of having accessibility at the forefront for everyone, we're able to create programming and services that should be able to be accessed by anyone, regardless of if they have a disability or not. And one last idea that emerged from the literature was cultural accessibility. And cultural accessibility was is I guess it could be said it's accessibility which involves removing physical, financial, and social barriers that keep certain persons from participating fully in everyday life. So while we're still training our staff and developing collections for accessibility, it's important to ask why and what encourages them to continue the development of accessibility service. And that could be, with the core of the profession itself, economic reason, and the reality that we live in. Um, so cultural accessibility is an idea that should be considered before any type of like physical or technological issues of accessibility arrive. So it kind of helps with that, it's not always one size fits all, which is like with disability, and it adds greater depth into the cultural considerations to be had when trying to navigate accessibility within libraries.